Prevention planners are pressed to put in place solutions to urgent substance misuse problems facing their communities. Research and experience have shown that prevention must begin with an understanding of these complex behavioral health problems within their complex environmental contexts. That is why the EPIC Coalition follows the Strategic Prevention Framework created by SAMHSA, or Substance Abuse and Mental Health Services Administration, which includes 5 steps and 2 principles. They are: assessment. Identify local prevention needs based on data. In other words, what is the problem? Capacity. Building local resources and readiness to address prevention needs. What do we have to work with? Planning. Find out what works to address prevention needs and how to do it well. What should we do and how should we do it? Implementation. Deliver evidence-based programs and practices as intended. How can we put our plan into action? Evaluation. This is where we examine the process and outcomes of programs and practices. Is our plan succeeding? The Strategic Prevention Framework is also guided by 2 cross-cutting principles that should be integrated into each of the steps that comprise it. Principle 1 is cultural competence. This is the ability of an individual or organization to understand and interact effectively with people who have different values, lifestyles, and traditions based on their distinctive heritage and social relationships. The second principle is sustainability. This is the process of building an adaptive and effective system that achieves and maintains desired long-term results. The EPIC Coalition supports the Social Development Strategy, an evidence-based framework which organizes protective factors into a simple strategy for action to promote positive youth development. The Social Development Strategy identifies the following key components to increase protective factors for young people in your community. Healthy beliefs and clear standards for behavior. Young people are more likely to engage in healthy, socially responsible behavior when parents, teachers, and the community around them communicate healthy beliefs and clear standards. Bonding. Strong attached relationships with those who hold healthy beliefs and clear standards are an important protective influence. To create these bonds, young people need opportunities. To provide opportunities for active participation and meaningful involvement with pro-social others, including families, schools, communities, and peer groups. Skills. To teach young people the skills they need to succeed. Recognition. To provide consistent recognition and praise for their effort, improvement, and accomplishments. The Social Development Strategy also recognizes the important influence of individual characteristics on the capacity to take advantage of other protective processes. Characteristics such as positive social orientation, resiliency, and intellect can facilitate bonding and, in some cases, can be nurtured by communities and adults.